The sound of ambulance was always heard at the entrance of ER department parking area. The medical officer, along with the nurses, rushed out to check out the patient, was brought in by the ambulance every now and then. Sound of screaming with nothing out ordinary there. Despite that, there was a man who walked into the ER room with a pale face and pain expression. What could it be?
Excuse me, my right belly is very hurt right now. Can you get me a doctor?
Okay, sir. Please wait for the doctor. You can sit over there.
The nurse contacted the medical officer in charge to get the needed help for the patient. The medical officer rushes over as soon as she could.
Okay.
What did happen, Ms. Ashwini?
That's the patient, doctor, with complaints of lower right belly pain.
Alright, let's get on that. Hello, sir. I'm your doctor in charge. May I know where exactly are you feeling the pain?
Hello doctor, I feel my pain on my right abdominal. I neglect it as a muscle cramp, but the pain get worse with each symptom.
Okay, can you explain more about your pain symptoms?
I am vomiting for a few days, and I also have a constipation and loss of appetite. And last night I have a very high fever. Can you help me, doctor? I regret. Oh.
Alright, I understand. I need to do some physical examination on you. Can you lie down for a bit?
Alright.
Okay. So, excuse me, sir. Do you feel pain here?
Oh, yeah.
Alright. How about now? Alright, okay. I think, sir, you might have appendicitis. So, for further confirmation, I'm going to refer you to radiologist. So, I hope you'll get better. Don't worry, sir, we know how to treat this thing. Gonna be better soon.
Okay.
Ms. Ashwini, please make arrangement in the radiology department and inform Dr. Sukmijit, and also Dr. Theo. Alright?
Thank you.
Hello, this is Dr. Sukmi.
Hi, doctor. I'm Ms. Ashwini from ER. We have an emergency case. The patient is 20 years old and having lower right abdominal pain. We need the radiologist department's guide on this. The MO suspects is to be appendicitis. We will bring the patient there shortly.
Noted, Ms. Ashwini. We will wait for you here.
As soon as the medical officer and the nurses done the examination, they rushed to the radiologist department to make an X-ray for Mr. Hafizuddin.
Good afternoon, Dr. Sukmijit.
Good afternoon, Dr. Deepa. Tell me about the case.
Doctor, I suspect this patient might have acute appendicitis. When I examined the patient, I felt tenderness at his right iliac fossa, and he also jumps a little when I extend his right thigh or touch his membrane point. He cannot walk or squat, so that's all for now, doctor. You have to tell me about it.
Okay, noted, Dr. Deepa. I'll have a look at it once I have the results of the abdominal X-ray.
Thank you, doctor. I'll leave it to you.
Thank you, Dr. Deepa.
As all went well at the registration process, the surgeon and the radiologist were discussing about the patient diagnosis and the steps that should be taken.
Dr. Sukmijit, may I know the results of X-ray and your diagnosis for the case?
Yes, Dr. Theo. So, based on the abdominal X-ray I've taken, I've identified that this patient has acute appendicitis. I have come to this conclusion as I've paired the X-ray result with the symptoms that you have mentioned, which is tenderness at the right iliac fossa. The location of the appendix is at the most common position, which is the retrocystal position, and you can access this via the McBurney point without any complications.
Thank you, Dr. Sumiji.
My pleasure, Dr. Teo.
Mr. Subir, can you prepare for surgery and request an operating theatre as soon as possible and ask for the permissions of patient's guardian?
Sure, Dr. Teo. I'll prepare the OT as soon as I can and also service the necessary equipment. I'll let you know once you're good to go.
Coffee at 5?
Sure.
The surgeon assistant, the surgeon technologist, and the anesthesiologist meet up at the surgical room to prepare for the surgery, while the nurse prepare the patient for the surgery.
Good day, Mr. Hafizuddin. I'm Dr. Teo and I will be a surgeon. We will conduct a laparoscopic appendectomy to treat your acute appendicitis. Please don't be afraid and worry. We will handle that. Take a good rest. Please do call me if there's any emergency, Nurse Aswini.
Noted, doctor. I'll ring if there's any issue.
Hi, I'm Dr. Suba. I'll be your anesthesiologist for this surgery. I went through the charts to see your past medical history, surgeries and allergies. Everything looks fine, there's nothing for you to worry, and you're in good hands. They have done this kind of surgeries a lot and there's nothing for you to worry about it, alright? I will pass to my colleague to explain about your diet.
So hi, Mr. Hafizuddin. I'm Muhammad Shafiq. I'm your nutritionist in charge. And as you have to undergo emergency surgery for your appendicitis, you'll need to fast starting from 8 p.m. tonight until 8 a.m. tomorrow morning, which is the time for your surgery.
Alright. Thank you, doctors. I understand, Mr. Shafiq. Thank you.
I'll be back later to remind you about your fasting time. Take rest until then, Mr. Hafizuddin. Bye.
The day's end, and Mr. Hafizuddin was forced asleep due to the exhaustion. Soon enough, the night blended into the daylight, and it was a brand new day. The surgery was carried out as scheduled. The doctor tried their best to make the surgery success.
Dr. Suba, Mr. Subir, any updates on our patient's condition?
The patient is still under anesthetic and there's no any negative feedback from the patient yet. You did a great job, Dr. Teo.
Well, Dr. Teo, all I can say is some good improvements on him. The vitals are stable and no complaints as of yet.
The surgery ended and it was a success. Mr. Hafizuddin was brought back into the ward to get some rest. After a few hours later, he woken up. The surgeon in charge came to visit him to check on his condition.
Mr. Hafizuddin,
Hi.
how are you feeling? Is there any pain whatsoever?
I can feel no pain, doctor. Thank you for treating me.
You are doing very, very well, Mr. Hafizuddin. You need to stay with us one more day for further observations. Once your post-test results are good, you will be discharged. Once you are home, you need to take good care of yourself. You need to take good care of your site of surgery to prevent any unwanted complications. Take your medications all on time. But please don't be worried. I will provide you with a medical certificate for a week, and you rest for a week lah. Okay. Take good care, Mr. Hafizuddin. I will be leaving now. Don't hesitate to come back if there is any discomfort.
Thank you, doctor, for helping me.
Okay.
As the post-operation results were good, the surgeon issued the patient discharge. The nurse briefed the patient about discharging process and the medication collection. The patient went to the pharmacy to collect the medication that have been prescribed by the surgeon.
Mr. Hafizuddin.
Hi. Okay, hi there. You Mr. Hafizuddin?
Yes.
Okay, cool. Can I confirm your ID number?
Yes, my ID number is 05132210.
Okay. Thank you, Mr. Hafizuddin. My name is Radima Abdulrahman. I'm your pharmacist, and may I have your prescription list, please?
Yes,
okay. So, hope you're feeling better now after the surgery, sir.
Yes.
And especially for the last few months now. So yeah, first of all, we got antibiotics, got called Zoin. Make sure you take them 1 tablet for 3 times. Yeah, 1 tablet for 3 times per day after every single meal. We got some painkillers also for the pain. Use them whenever you need to, and don't worry about it. And lastly, don't eat too much spicy food, man. It's not good for your stomach. I think think that's it. Is there anything else, any concerns or any comments you want to have for my service or like the hospital in general?
I think I don't have any concerns. So thank you, Mr. Radin, for this prescription.
Okay,
And
no problem.
hope you have a nice day.
Okay, you too.
Due to the great teamwork of all hospital staff, Mr. Hafizuddin was freed from the pain and was able to go back.
Alright, clap.